To reach Narayana, we must serve the Daridra Narayana, the starving millions of the land. Inspired by this rousing call of the patron saint of modern India, the Swami Vivekananda Medical Mission was started in 1972, choosing the hilly tribal district of Wayanad as its center of activity. Wayanad is situated on the Western Ghats. It is green and full of natural beauty. Coffee and tea are grown here. The Vanavasi brethren, coming under nearly 18 denominations like Kurichya, Kuruma, Paniya, etc., and the primitive tribal group of Katunaiga, form nearly 17% of the total population of 6 lakhs of the district. They were living happily depending on forest produce and agriculture for livelihood, and had fought the British under Parashi Raja. They had never thought of buying and selling land or deeds and rights, and as a result, when lands were divided and seized or encroached upon by settlers from the plains, the Vanavasis became homeless. The hapless tribals are now faced with the problems of unemployment, malnutrition, anemia, and all sorts of diseases, including diabetes and cancer. The mission started its activities in Wayanad to fight all these ills affecting our less fortunate Vanavasi brethren. The late Radha Gopi Menon, a philanthropist par excellence who came to know about the project of the mission, immediately volunteered to donate 1 acre of prime land with existing buildings at Muttil near Kalpetta, the present district headquarters. Thus came into being here a free clinic cum dispensary with Dr. Krishnamurti of Kottayam as the physician. Its growth speeded up with the arrival of a dedicated young doctor, Dr. Dhananjay Sagdev from Nagpur in 1980, drawing inspiration from the RSS. With munificent financial assistance from institutions like the UPASI, Tea Board, Coffee Board, Spices Board, Comtrust, MSP Jain Trust, Dharmapal Jain Trust, etc., and with the unstinted support of the people from all over, the project could make substantial progress, and the clinic cum dispensary gradually developed into a 30-bed hospital, opening up new avenues of service activities. The new maternity ward, inaugurated by Dr. Raghavendra Kulkarni, All India President, Arogya Bharati, in January 2004, is a facility made available with financial assistance from Sri Narayana Swami of Krishnagiri. The hospital has 3 permanent doctors: Dr. Sagdev, Dr. Anuj Singhal from Saharanpur, UP, and Dr. Tarasri Singhal from Mysore. and 10 visiting doctors specializing in various branches of medicine. The current facilities in the hospital include the OPD, a 30-bed ward, a maternity ward, a well-equipped laboratory, X-ray, ECG, cardiac monitor, ultrasound scan, gastroscope, free dispensary, minor operation theatre, ambulance. The number of patients reaching the OPD comes to 200 a day. Specialty clinics in the hospital. Medicine clinic. Dr. Govindaraj, retired professor of medicine, Medical College, Calicut. Dr. Gopalan, retired DMO, Calicut. Surgery clinic. Dr. P.A. Bhaskaravariyar, retired professor of surgery, Medical College, Calicut. Orthopedics clinic. Dr. P. Bhaskaran Nair, retired professor of orthopedics, Medical College. Gynecology clinic. Dr. Wilson, professor of gynecology, Medical College, Calicut. ENT clinic. Dr. K.C. Vijayaraghavan, retired professor of ENT, Medical College, Calicut. Child clinic. Dr. Rajesh P., children's specialist. Eye clinic. Dr. Sabita Narendran, eye specialist. Dental clinic. Dr. Ranjit, dental specialist. Skin clinic. Dr. P. Raman, skin specialist, Medical College, Calicut, retired. Special eye clinic. Comtrust Eye Care Society, Calicut. Ayurvedic clinic. Dr. E.B. Abraham, Kotakal Ayurvedashala. Pain and Palliative Care Clinic, set up with the assistance of the Calicut Medical College, is doing yeoman service in alleviating the pain of patients with advanced stage cancer and similar conditions. The mission is also running 5 weekly sub-centers: Suliyod, Muttanga, Tirumanattur, Cherukara, Kannankode. The building for the sub-centers at Cherukara and Kannankode were donated by the Hindustan Petroleum Corporation Limited. The mission's mobile medical unit was formed for serving in tribal hamlets situated in remote areas without any form of road access or other means of communication. The mobile medical units, with doctors and staff with medicines, visit such hamlets and conduct diagnostic and treatment camps regularly, thus taking health care to the very doorsteps of the ailing tribals. Nearly 400 camps are conducted in a year, treating 25,000 patients. The incidence of sickle cell disease, a disorder of hemoglobin prevalent among the tribals of Wayanad, was detected and diagnosed first by the medical officer of the mission. Alerted by the mission, the Calicut Medical College conducted detailed studies in the field, and the All India Institute of Medical Sciences, New Delhi, evinced keen interest in the matter. As a result, a 3-year project control program for sickle cell disease in tribal populations, approved by the Government of India, was launched under the supervision of a coordination committee comprising the District Collector of Wayanad as the chairman and the DMO Wayanad and Dr. Sagadev as coordinators. The mission hospital is the monitoring cell, and Dr. Anuj Singhal of the mission is the senior research fellow.
Sickle cell is a genetic disorder of the red blood cells. It is passed to the next generation by their parents through the sickle cell gene. In all our bodies, we have red blood corpuscles, in which contains 70% hemoglobins. In normal conditions, the shape of red blood corpuscles is round, but in sickle cell patients, in the deficiency of oxygens, it takes the shape of sickle.
Out of 1.07 lakh persons covered so far, 1,292 were found affected by this disease, and 8,500 were identified as carriers. The HPCL has donated a vehicle for the sickle cell disease control program. The mission has entered into an agreement with the prestigious Aryavaidishala Kottakkal to find out proper Ayurvedic medicines for the treatment of the disease.
This project was started, as you know, in June 2003, and so started for finding out some remedy for this incurable disease, sickle cell anemia, which is common here among the tribes. And after discussion with the people here, that is Vivekananda Center, Vivekananda Medical Mission, we also thought of doing something in this matter.
Tuberculosis is yet another ailment that causes a large number of deaths among the tribals. The mission hospital is a monitoring unit under the RNTCP and is the recipient of the Certificate of Appreciation on World TB Day on 24th March 2003. Under the Swasthya Mitra scheme, batches of tribal youths are given training in first aid and hygiene and are deputed to work in the tribal colonies to guide the people in molding their lives in a hygienic and healthy way. More than 150 youths are engaged in the project, and 50 of them have first aid boxes with them. A comprehensive survey of the tribal population, including details of land holdings, income, employment and health, is being conducted with the assistance of the house surgeons from Calicut Medical College in order to formulate a scheme for the total development of the tribals. A mandir dedicated to Dhanvantari, the presiding deity of health, was consecrated at the hospital campus to provide succor and solace to the patients and their relatives and helpers. The bamboo crop project was initiated with a view to rehabilitating the patients of sickle cell disease who are not able to do any heavy work. The Bamboo Crop Training Center was formed to give them training in handicrafts using easily available materials like bamboo. The project was conducted with the financial assistance of the Government of Kerala and was inaugurated by the District Collector of Wayanad. Under the Grama Seva Samiti scheme, the mission is conducting 7 Gramina Vidyalayas and self-help groups. Under the Chest Foundation project, drinking water supply and sanitary conveniences are being provided in 7 tribal colonies. Under the Sanjeevani project, health awareness campaign classes are conducted in tribal colonies using audio-visual cassettes, charts and maps, etc. The mission is a recipient of awards and recognition from Janakalyan Samiti, Rotary Club, IMA and JCs. The mission is receiving financial assistance from the central government for its hospital and mobile projects. All accounts are computerized and audited. Donations to the mission are exempted from income tax under Sub 80G of the IT Act. As a result of the activities of the mission, the tribals have become more health conscious, visiting hospital and taking medicines when ill. It is satisfying to find that the tribals have good faith in the mission, as is evident from the increasing number of beneficiaries, which was 90,000 last year. Future plans. The mission plans to open more sub-centers, conduct more camps and spread Swasthya Mitra project to cover all the tribal colonies in the district. In the true sense of the word, this is a sadhana of service at the holy feet of our sacred motherland.